Alrighty, hi everybody. This is our senior home visit presentation. I'm Sam, and we got Mike, Anna, and Jesse on with us today. So for our senior home visit, we had a senior volunteer whose name was Richard or Dick Jones. He was an elderly widowed male, and he lived independently in a single-story ranch-style home. He actually had a pretty active lifestyle for his age. He went to the YMCA pretty frequently and played a couple different sports at the YMCA. But he did have some issues with hip osteoarthritis, and he had a THA scheduled in a couple months, I believe. So the home visit structure, essentially we had a 40-minute virtual interview with Richard, kind of discussing his family life, living arrangements, his work, interests, culture, healthcare, his experience with PT in the past, kind of his tips and tricks for us, how we should treat elderly patients going forward in our own practice. And then we did a 15-minute home safety evaluation where we kind of looked at his living arrangement. He had like booster seats for his toilet, handles for his shower, his car, things of that sort, just to give him a couple pointers on how to keep things safe. And then we did a 5-minute administration of the geriatric depression scale and just some other general questions for Richard. And the more we talked to him, the more we found out how great of a guy he was. And it was ultimately a really great experience.
Yeah, so to echo what Sam was saying, I think all of us were really impacted by this Zoom conversation more than we thought we would be impacted by it. So some common aha moments that we had were how he talked about the importance of listening, of truly listening to your patient, and then establishing an open, trusting relationship. So something he talked about was that the relationship between the patient and the healthcare provider is almost even more important than the intervention itself. And that motivating and just really important relationship can really help the patient. So a second thing we talked about was the influence of physical therapy to maintain activity level and getting patients back to their hobbies and interests. So although Dick was interested in physical activity, he expressed that he has recently been unable to because of his knee osteoarthritis and his hip as well. And that's something that PTs can help modify things for and help fix to get patients back to the activity level that they would like to. And then additionally, we talked with him about how he really prioritizes spending time with his family. And I think many of us, even though we are a lot younger than him, we have similar priorities as him. So I think that's important to remember, that they are more similar to us than we think.
So tying this to some lecture content and talking about specifically elderly living options. So there's really a continuum of care talking about elderly living options. So it starts independently living at home would be the least restrictive environment to live in. And then getting to more restrictive goes to living at home with services, living in family members' home, and then all the way to living in a facility, which would be the most restrictive environment to live in, which is like an independent living facility, an assisted living facility, and a long-term care facility. So something called aging in place has been studied and found to have better clinical outcomes than nursing home residents. And that's really just living at home independently. And they have a better outcomes in cognition, depression, incontinence, and ADLs. So this could have anticipatorily impact on Richard as potentially his physical and cognitive function declines. He'll need to make a decision about his living options. And I think as a group, we would recommend living at home as much as living at home as long as he's able to with services due to that aging in place principle. But obviously you need to take into account the potential for isolation and depression when an elderly person is living on their own.
Okay, and lastly, we've attached some resources. They are links embedded in the PowerPoint if you guys want to check them out later. But we really wanted to focus on how you can make an elderly person's home environment more accessible for them if they're a fall risk or just looking to be more mobile around their house in a safe way. So universal design is something I'm sure we're all familiar with after our SCI units. And this website just gives you more information on what it is, its benefits, and it also gives you helpful case examples that you could apply to you and your patients to help them understand how they can modify their home environments to be more accessible. And then Mike mentioned aging in place earlier, but this website is also super helpful from the U.S. Department of Health and Human Resources. And it can just give people planning advice and support and resources as you age to make your home more accessible. So that is the end of our presentation.
Awesome. Thanks.